Good morning. I am Dr. Rajshekhar, Professor and HOD of ENT Department, Sree Balaji Medical College, Chennai. I am going to talk about ENT Department of Balaji Medical College first. See, the ENT department is more proximity to our patients. Most of the patients are coming with common cold, allergy and sore throat. When we see outpatient department, the surgical cases and medical cases are different. When you go into the medical cases, most of the cases are URI. Next is abdomen, pain abdomen. Next is generalized body pain. Like that, we have statistics. In these statistics, the OP patients, we have 10% of the entire OP. For example, if we get 100 patients per day, any hospital, the 10% will be URI, which belongs to ENT department. In that we have so many regular problems. Patient will come with us allergic rhinitis and ear pain, throat pain. Nowadays, very common, the allergy is very common because of the dust and pollution. In this problem is aggravating every year, that our OP strength is increasing every year. This is the main problem in ENT right now. Allergy we cannot just neglect, because the allergy will become rhinitis, nose block, sore throat. It will go on extent. So in this area we have to address first. Next is our ear pain is very common among children. For example, the child cries in the night. There are three differential diagnoses. One is ear pain, second is the foreign body, third one is abdominal calling. This is very common differential diagnosis even for pediatricians. So ear pain is very common among pediatricians. That will be addressed by only ENT surgeons. In this way, we are dealing patients every day, and it's a day-to-day problem of the patients and general population we are addressing every day. I'll deal with common disease of the ear. Wax is a very important one. Every general population is having wax. Same time, it can give problems, and it will make you to become a patient. When the wax is accumulated, it will become problem for the patient in the way of hard of hearing and pain, and sometimes they may go for severe pain like keratosis obturans. So at the same time, wax has a protective function and lubrication of the ear. When we see wax, that is a normal ear. Suppose the patient is having CSOM or external otitis, after the treatment, if you see wax, that's going to be a normal ear. Our treatment is success. So presence of wax is good sign. Second one is automycosis. This is a fungal infection of the ear. Commonly Aspergillus, Candida and Fumicatus. Aspergilla is the one. It is a greenish in color, and Candida is in white in color. Fumicatus is in sometimes bluish green also. Symptoms of automycosis is intense itching, ear pain, watery discharge with musty odor. This is also one of the common conditions which causes severe ear pain to the patient. Second one, otitis externa. This is called swimmer's ear. It's an inflammatory or infection of the external auditory canal caused by commonest infection, Staphylococcus aureus. Furuncle. For example, furuncle comes in the face. This will not cause so much of pain. But same furuncle comes in the external auditory canal. It will cause pain because skin is closely adherent to the cartilage. Okay, so far we discussed about external auditory canal or external ear. Now we are going to deal middle ear problems. Commonest problems, serous otitis media, which is very common in children. This is due to negative pressure in the eustachian canal that blocks the middle ear. So same negative pressure created in the middle ear, and there will be a secretions due to osmosis. First, non-purulent fluid, which is non-infective, non-painful, only it causes hard of hearing, commonly seen in school-going children. This is again acute otitis media is different from serous otitis media. The main thing is pain, ear pain, fever, and deafness and tinnitus. All these things will be in the acute otitis media, whereas serous otitis media only hard of hearing will be there, which will be neglected by children because it is commonly occurs in children. So it will be neglected by children because children will not tell the symptoms to us parents, but it will be neglected. So this is very important area you have to address. But acute otitis media will not have any problem because patient will have severe pain, other symptoms like ear pain, deafness, and tinnitus, all will be there, and naturally children will complain to the parents. This is chronic suppurative otitis media without pain, but mainly discharge will be there. Then patient will go along with, live along with the chronic suppurative otitis media for a long time. That will not cause major problem. Like for example, the ear is having or pus is there, the patient will neglect. Same thing, pus in the eye, the patient will come to the eye surgeon immediately. That is a problem for the ENT surgeon. They will come after a long time. They always land with chronic suppurative otitis media only. So far we discussed about common disease of the ear. Next we are going to discuss about deviated nasal septum, that is nose case. So deviated nasal septum, next is a nasal problem. So far we discussed about the ear problem. 70 to 80% of people are having this deviated nasal septum due to intrauterine pressure or birth trauma. Only we address when the deviated nasal septum is having nasal obstruction with epistaxis or sinusitis. Otherwise, they can live with the deviated nasal septum lifelong. This is rhinosinusitis. I already told you in the introduction itself, the commonest disease. We have 10% of OP cases. According to statistics, if the 100 patients comes already, I told you 10% will be the ENT cases. Rhinosinusitis. Among 10%, this is almost 5 to 6% rhinosinusitis. So allergic rhinitis. So now you are even in the classroom. You are right now. You are normal. You will become. You will have sneezing, running nose when you go out of the room. That is due to allergic reason. So allergy we don't know what is the reason. Like that, when you go out of the room, you will get rhinosinusitis. So suddenly you will get it. So far we discussed about acute problems. This is called nasal polyp, which is a chronic problem. For example, if you don't treat allergic rhinitis or infection in the nasal cavity, this will become a nasal polyp. Polyp is just edematous mucous membrane. Types antroconal polyp, ethmoidal polyp. There is a difference between antroconal polyp and ethmoidal polyp. Antroconal polyp is bilateral. Antroconal is unilateral. Ethmoidal polyp is bilateral. The allergy is etiology for ethmoidal polyp. Antroconal polyp is an infection. Ethmoidal polyps are bilateral and multiple because the etiology is allergy and multiple because 15 to 18 air cells are there. The symptoms are nasal obstruction, nasal discharge, anosmia, headache, and mass protruding from the nostril. The patient will come with us in our setup, in our country, mostly comes with mass protruding from the nostril. They won't come at the early stage. Treatment of surgery is polypectomy. This is epistaxis, bleeding from the nasal cavity. This is from the little's area. Little's area is situated in the anterior inferior quadrant of the nasal septum. It is because here it is a vascular area, more vascular area. It is here more anastomosis of the internal and external carotid taking place. External carotid artery, superior labial artery, and sphenopalatine artery and greater palatine are branches from the external carotid, and anterior ethmoidal and posterior ethmoidal are branches from the internal carotid, which also supplies the little's area. There is anastomosis of internal and external carotid artery taking place in the little's area. These are more vulnerable for bleeding, even small trauma. This is even during school, you used to say the patient is standing in the prayer. That time patient will have bleeding. This is due to breaking of the small blood vessels due to heat. This is also called Kesselbach's plexus. And this epistaxis is very common in adult due to hypertension. The patient bleeds due to hypertension in the nasal cavity. He is lucky because if he doesn't bleed in the nasal cavity, he will bleed in the brain. CVA, cerebrovascular accident, will occur. Once epistaxis occurs, patient will be happy because the diagnosis will be known, because unknown hypertension will be known that day. Second one, it's just like a valve, it opens. So the pressure in the brain also reduces and patient will become normal once we treat the epistaxis. Foreign body. This is very commonly seen in children, so maybe organic or inorganic. So live or organic, inorganic means live insects are sometimes very common, that goes into the nasal cavity or ear. For example, mosquitoes. This very common. Mosquitoes, ants will go into the ear cavity and nasal cavity very commonly in children. And also unhygienic places. In this, inorganic foreign bodies are very dangerous one because it produces unsaturated fatty acids, will damage the mucosa and skin around the foreign body. So the foreign body should be handled immediately. I already told you my introduction. The children cries suddenly cries in the night. That my professor of pediatrics used to tell. Only three diagnoses: foreign body, second one ASOM, third one abdominal colic. So common conditions of the ear, nose we have seen. Next we are going to see throat. So this is the most common cause of the throat tonsillitis, commonly caused by hemolytic streptococci. Presentation is sore throat, fever, difficulty in swallowing, pain in the ear. Adenoid hypertrophy also very common because it all belongs to Walden's ring. Walden's ring consisting of tonsil, adenoid, tubal tonsil, and lingual tonsil. So anything hypertrophy, anything gets infected, patient will have throat pain. Adenoid is common in children. It persists till 14 to 16 years. After that, it disappears. If you check in the adult, adenoid will not be there. In 5 to 10% of people only, persistent adenoid will be there in the adult. Otherwise, adenoid disappears like thymus. Next, GERD. This is right now after endoscopy invented. This GERD is a very common disease. It causes throat pain. It is a condition in which stomach acid or bile acids flow into the food pipe and irritates the lining. Acid reflux and heartburns are the most common symptoms of the GERD. Third, next is vocal cord polyp. It is a unilateral and pedunculated. It is a result of vocal abuse, misuse. Presence of hoarseness of voice and large polyps may cause dysphonia and side and choking sensation. It is due to voice abuse. The cause is voice abuse. And vocal nodule also one of the conditions. That is also voice abuse and very common in smokers. This is epiglottitis. It is due to Haemophilus influenza infection. It is commonest in children. It can occur in adult also, but it causes very painful swallowing and also difficulty in swallowing, and with additional symptoms like fever, malaise will be there. It is potentially life-threatening condition in children because it causes laryngeal edema. Patient will go for respiratory choking. So far, we have dealt common problems of the ENT. This is the very that I told you in the early. The 10% of OP cases of ENT are belonging to this category only. The 90% are other cases which we are not going to deal with. In these cases, more than that, I have discussed only very simple cases of the ENT. We are dealing also malignancy and chronic inflammatory disease of the tuberculosis, syphilis of the nasal cavity, oral cavity, everything. So in this conclusion, we are main part of the general population who are sick day to day. That is my, again repeat, we are the main part of the population who are getting sick day to day problem. So we are dealing with day to day problems. So this is the main problem of the ENT department doctors, and we have to deal with the patients. Thank you.